All right, so let's keep moving, and I'd like to introduce Dr. Nicholas Zdenkowski, who's speaking today on breast cancer myths. Nick is a specialist medical oncologist at the Breast and Endocrine Centre and Lake Macquarie Private Hospital, and that's in the Hunter region in New South Wales. And he's also the medical advisor at Breast Cancer Trials. Hi, Nick.
Hi, Anna. Thanks very much, and thanks for the opportunity to speak. So I'm going to be talking about breast cancer myths and some of the facts to counter those myths. And working in oncology, you find that there are as many or more myths than you could care to imagine. And some of those myths can be grounded in some level of truth, whereas some are frankly quite imaginative. So I'm going to cover a few of those. Firstly, I'll just move my slide. There we go. So a question that comes up a lot is, well, I've developed breast cancer, but I don't have a family history. And there's an assumption or a question within that most breast cancers are thought to be hereditary, but that's actually not the case. And 9 out of 10 breast cancers are not associated with a strong family history. And by strong family history, I mean 3 or more close relatives, first or second degree relatives, who have been diagnosed with breast cancer or with an associated cancer. And that might be ovarian cancer or other cancers that fit within one of the gene syndromes. And then of those 1 out of 10 breast cancer patients who has a strong family history, only half of those are due to a known gene, such as the BRCA1 or 2 gene. There are about 5% of breast cancers that are associated with strong family history, but that they don't have a known gene. And there's probably a gene or a combination of genes that are contributing to that breast cancer, but the research hasn't identified those genes yet. There are some tools out there that you can use to determine your risk of breast cancer and the potential for preventative treatments. One of those developed by one of our BCT researchers, Professor Kellyanne Phillips, is the iPrevent tool, and you can see the URL there, www.iprevent.net.au. So many women who do develop breast cancer don't have a family history at all. And they'll often ask about what might have caused that, and I'll touch on that in a moment. I'll mention the BRCAP trial again, and that can be, you can find out more about that through Breast Cancer Trials or the Breast Solution website. But it aims to give women an option to prevent breast cancer apart from the standard approach at present, which is to offer bilateral complete mastectomies. So the second myth that I'm going to talk about is that stress causes breast cancer. And this has been shown in mice that stress can contribute to breast cancer. But we know that there's a very big gap between what happens in mice and what happens in humans. And the observational studies looking into hundreds of thousands of women have not found compelling evidence to link life stresses with developing breast cancer. There's potentially a lot of confounders here. So people who are stressed may not exercise as much, they might drink more alcohol, and therefore they may have risk factors that are known to be associated with developing breast cancer. And so the studies need to be very careful in teasing that out and working out what is attributable to the stressful life events compared to other associated behaviours. Similarly, stress doesn't make breast cancer more likely to come back after it has been diagnosed and treated. And I'm not going to talk about the range of effective stress management options, but listen to what Leslie has to say later on this evening about stress. So what can you do to reduce your risk of breast cancer if you're able to maintain a normal weight, which is a body mass index of between 19 and 25, which is your weight according to your height. Regular exercise, and the guidelines suggest 150 minutes per week at least moderate intensity. Minimise or avoid alcohol intake, and I'll say that none is best, but overall, even if you're able to do all of those things, it's not a guarantee against breast cancer, and screening and awareness are still needed. The third myth to address is that there are special foods that prevent breast cancer. And whilst I will contradict myself here and say that there are a couple of foods that are helpful, what I'm alluding to is that there are a bunch of things that are purported to be a special guarantee against developing breast cancer, or once you've developed breast cancer, a guarantee that they will prevent it from coming back. And so supplements or the latest superfoods, as long as you have a balanced diet, do not prevent breast cancer specifically. There's concern that soy or dairy products might be associated with breast cancer, but this is not true. And once again, there have been very large-scale trials, observational studies that have looked into both of those and have not found a link between soy or dairy products or breast cancer. And in fact, some large studies from Asia indicate that a soy intake that will help to prevent breast cancer as long as that soy intake starts in childhood or adolescence. Also, meat and dairy products do not have any evidence of significant levels of additives or hormones that have any impact on breast cancer. So the idea is to aim for a diet that has plenty of vegetables, and there is some evidence to support green leafy vegetables in prevention of breast cancer. Fruit, particularly berries and stone fruit, whole grains, lean protein, and more plant-based protein than animal-based protein is preferable, and fibre as a well-rounded diet. There are some other concerns about causes of breast cancer, and these things are not associated with the development of breast cancer. The use of underarm deodorant, underwire bras, breast implants, and I'll qualify that to say that there's a very rare form of a breast-associated lymphoma to do with textured implants, but this is very rare. But there is some information statements out there, particularly on the BCNA website, that you might like to look at if you're concerned about that. Assisted fertility treatments like IVF is not associated with a significant increase in breast cancer. Sugar in itself is not a risk factor for breast cancer. Trauma to the breast is something that a lot of women ask about, and I suspect that it draws attention to the breast, and then that may lead to the identification of a lump or an abnormality that then leads to a diagnosis of breast cancer. But the trauma in itself is, there's no suggestion that that has caused the cancer in the first instance. Likewise, carrying a mobile phone, whether it's near your breast or not, does not contribute to breast cancer. Now, there's a concern that all breast lumps are cancerous, but most lumps are not cancer. They may, however, need to be checked. The corollary of that is that not all cancer presents as a lump, and many breast cancers are diagnosed from other changes, such as nipple discharge or new nipple inversion, skin thickening or redness, or change in breast shape, breast pain. But be aware of your menstrual cycle if you do experience those sort of symptoms, because there may be cyclical changes. And if you do have any of those changes, then see your GP for physical exam, scans, and potentially a biopsy. The aim of breast screening is to help detect cancers early before they cause symptoms, and at which time they can be treated at an early stage and more likely to be cured. All breast cancer is not the same. And there's a thought that, well, you're diagnosed with breast cancer, that means that it's deadly, and it's not. There are many different stages of breast cancer, many different types of breast cancer, and they need individualised treatment. And that's what Prue was alluding to earlier, talking about the need for personalised treatment and the ability to find the different subtypes that are most likely to respond to treatment. Some cancer types are more likely to need chemotherapy, some don't at all. Many breast cancers will be cured with surgery alone, but we need to find out better ways of working out which cancers are the very low risk. And the Breast Cancer Trials Expert Trial is one of those that may allow de-escalation. There are still more than 3,000 Australian and New Zealand women who die each year of breast cancer, so therefore we need better treatments. So another concern is that only older women develop breast cancer, but younger women can develop breast cancer as well as men. 1 in 100 breast cancers is diagnosed in men. Breast cancer in young women is more likely to have a genetic cause, such as with the BRCAP gene mutation, and 1 in 25 breast cancers occurs in women aged under 40. The age between 60 to 70 is still the age group in which breast cancer is most common, and breast screen invitations are sent to women aged between 50 and 75 that are available for any women over age 40. But because of breast density and the low rate of breast cancer in women under 40, mammographic screening is not especially effective. So I'm going to leave it there, and I will answer any questions.
Oh, thank you, Nick. That was fantastic. And we do often find on social media that breast cancer myths are some of the most common questions that we get asked all the time. So I do have a few questions for you, if that's okay.
Sure.
We have a question from Annie, and quite a lot of people have asked this question, and she's asked, are alcohol and sugar risk factors in breast cancer?
So I briefly mentioned this before. So Annie, the alcohol certainly is a risk factor for developing breast cancer, and there have been large epidemiological studies showing that any level of alcohol intake does increase the risk of breast cancer. However, at a low level, there is only a very small increase in breast cancer. And by low level, I mean 1 standard drink, which is 100 mils of wine or a midi of full-strength beer. Sorry for those who are elsewhere who use different measures. With a couple of alcohol-free days each week does not substantially increase the risk of breast cancer. But once you get to 2 or more standard drinks per day, then you're starting to get into a bit more of a risky range. So the question about sugar, sugar can contribute to breast cancer indirectly in increasing weight. So sugar is associated with an increased rate of overweight and obesity, and by that mechanism, sugar can contribute to breast cancer. But sugar in itself, as part of a balanced diet, is not a specific risk factor for breast cancer development. Cancer, I would say, is an omnivore. It will use anything as fuel, whether that's fat, protein, or sugar. And we need all of those for healthy functioning.
Yeah, well, thank you for that answer. A common question or a comment that we often receive from people is that they have conflicting information or read conflicting information in line. So you've done a great job to clear some of those things up. I've got another question from Erica. And Erica has asked, has there been any research on environmental causes of breast cancer?
Okay, all right. Thanks, Erica. So environmental causes I take to mean external influences that might cause breast cancer, because there's probably a lot of gene-environment interaction. So we're all made up of a lot of similar genes, but some of us have some different ones, and that can predispose to a greater susceptibility within the breast tissue to developing abnormalities that then eventuate into a breast cancer. So there's been a lot of concern about BPA recently, and there are mouse models, once again suggesting that BPA is an endocrine disruptor and may contribute to an estrogenic cause of breast cancer. The trouble is that BPA is pretty much ubiquitous in our society, and it's very, very hard to avoid and very hard to identify that there truly is or is not a link with BPA. There's a link between ionising radiation and breast cancer. And I mean, I've mentioned some of the other environmental influences in terms of your diet, alcohol intake, and exercise or lack of exercise contributing to breast cancer.
All right, Nick. Well, unfortunately, in the interest of time, we'll have to leave it there. But thank you very much for that. That was a great presentation.
A pleasure.
Thank you.